I'd like to welcome everyone to the Gallatin County COVID-19 press call today. Today we have on the call, we have Lori Christenson, who's the Gallatin City County Health Officer. We have Kallie Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. And I will turn it over to Lori.
Good afternoon, everyone, and thanks for joining. I'm going to go ahead and start with our weekly surveillance reports. Okay. So we'll start off with our case numbers. And as you can see, we are seeing a steep continued decline in the number of cases we're seeing here in Gallatin County. We're seeing really good progress being made in our overall case numbers. And as a reminder, I just want to indicate that we are still seeing high case numbers. So disease transmission is still occurring, but we are seeing significant improvements being made. And so specifically, as we look at the figures comparing last week to this week, we've seen a 32.7% decrease from where we were the last reporting period, which was 2/2. And again, like I said, I want to mark that we are seeing significant improvements. We continue to see high case numbers in our community. Similarly, we are seeing a decline in our percent positivity. So as you can see, we've come down a long ways from where we were at our peak here a few weeks ago. And we see this red line here is indicating that 10% positivity. So we really have a goal of being well below that red 10% line. So again, while we are definitely seeing some improvements, we still have a ways to go to get to that lower percent positivity level. And again, we're seeing those steady improvements. So yeah, this is trending in the right direction. And this figure again is representing our number of cases by vaccination status. And then moving into our hospitalization numbers, and Kallie can speak a little bit more to this, but we are seeing lower COVID-19 hospitalization numbers, which again are clear improvements from our previous weeks. Hospitalization rates are still higher than we would like to see if we think about COVID-19 hospitalization. So we are seeing improvements. We would like to see those a lot lower than we're seeing now. And then moving into vaccination rates, in terms of fully vaccinated residents, you can see in our age groups here, it's a little bit harder to see today, but in our, we've seen a 1% increase in these three age ranges. So our 60 to 69, 50 to 59, and our 40 to 49. We've seen a 1% increase in those in terms of individuals who have become fully vaccinated. And then finally, figure 8 here is showing, describing the vaccine doses that Gallatin County residents have received by MMWR week. And so we are seeing a little bit of a decline, as you can see here, in the number of individuals seeking vaccine. This still represents a good amount of individuals who continue to seek vaccine. So we like to see that we are still administering first doses, second doses, and again, that individuals are seeking that third dose to be fully up to date, which is important because we want to continue to use the tools we have available, which include wearing a well-fitting mask, getting a vaccine, being fully vaccinated and up to date, and then also testing and staying home when you're sick. And then with that, I just want to end with kind of where I started was we are seeing a nice decline in the number of cases. We are still experiencing high community transmission. So again, being really aware and being cautious and using those tools we have available are going to be really important as we continue to move through this pandemic together. So with that, I'm going to stop sharing my screen and hand it over to Kallie for any Bozeman Health updates.
Awesome. Thank you so much, Lori. So at Bozeman Health, we currently have, well, I just had this pulled up and then I need to do it again. I swear I was prepared and then I wasn't. Okay, so we currently have 16 COVID positive patients at Deaconess Hospital. We have no COVID-19 positive hospitalized patients at Big Sky Medical Center. Our critical care unit is at Deaconess Hospital, has 20 beds, and it is currently at 85% capacity. 4 of the 14 patients in the critical care unit are COVID-19 positive, with the remainder being other healthcare needs. Additionally, our medical unit is at 87% capacity and our surgical unit is at 83% capacity. Moving into testing a little bit, as of 8:30 this morning, this previous week, we have processed 831 swabs for COVID-19 testing, and that's compared to last week, which was 1,055. So we've seen a decrease this week in our overall specimens collected. Those numbers that I just shared with you are inclusive of testing sites at Deaconess Hospital, Belgrade Clinic, and our B2 urgent care locations. At Big Sky Medical Center, so far this week, as of this morning, we have processed 112 COVID specimens. And last week, we collected 140. So we're seeing a slight decreased demand in Big Sky as well. With these volumes that continue to decline, I did share last week already that we made the decision to close drive-through testing at Belgrade Clinic, and we have also made the decision to close the drive-through testing at Lot H on the Deaconess Hospital campus. If patients need testing, they can definitely still utilize our sites at Big Sky Medical Center, at Belgrade Clinic Urgent Care, at B2 Urgent Care, at our B2 Microcare location, and any of the outpatient lab locations at Deaconess Hospital. We may also have some clinics that are prepared to collect right there during patient visits as well. So there are definitely options still within the Bozeman Health location, as well as testing through the health department at Gallatin County Fairgrounds. This week, we've also made some changes to COVID-19 vaccine administration. Our joint vaccine clinic at Deaconess Hospital in entrance 4 is now closed. We at Bozeman Health have now moved those vaccines into the primary care clinics. So if you are needing a vaccine, please call your primary care provider's clinic or any of your affiliated clinics at Deaconess Hospital to schedule an appointment. And I do want to remind folks that when they do come for a vaccine administration, if they have already received a first dose and they're coming for a second dose, a third dose, or a booster, they need to bring their vaccine card with them so we can keep all of that in one location. Also, vaccines, as Lori has maybe said here and in other venues, is that vaccines are also available through the health department. At Big Sky Medical Center for our communities over there, we have the current vaccine administration continues as we've had the process for many months now. Individuals can call Big Sky Medical Center and they can schedule a vaccine appointment directly, calling that main line. We will continue to keep an eye on what the next few weeks bring with the potential of CDC approval for the additional pediatric vaccines for those kiddos under age 5. And we have plans in place for moving forward with that once we do get approval so we can get those younger kiddos in. I think that's all I have right now. Thank you.
Thank you, Kallie. And I will just follow up. I appreciate the prompt. We do have appointments that we've opened up for both Moderna and Pfizer here starting next week, February 18th, which is next week, next Friday, here at the health department. And Holly, if you can pop that into the chat where folks can find that information, I would appreciate that. So they have access to the information if you guys don't mind helping us share that information so others know that there are appointments available here at the health department as well for those who are seeking vaccine. I don't see MSU on today, so we'll go ahead and open it up for questions from all of you. No questions today? Hi, Juliana.
Hello, I will go ahead and ask a question. I am curious now that we're kind of seeing the downward peak, and we're leveled off a little bit more. If it kind of rang true that there were lower hospitalizations over the Omicron surge, as we've seen that news kind of statewide and even nationally that there were lower hospitalizations, but I was wondering if you guys have seen that data here in the county.
Lori, did you want to pull that up or did you want me to speak? I couldn't remember if you had one of those graphs in your report.
Callie, if you want to speak to it while I try and pull up the surveillance report again, that would be great. Thanks.
Yeah, we did see an increase as we saw the cases spike in the community, an increase in hospitalizations, but it wasn't to the amount that we saw previously. So I don't have specific numbers, but we did see a slight increase, but it wasn't an increase to the degree that we were seeing previously. And there are many hypotheses out there as to why that is the case. It could be that that people are vaccinated. It could be that we just have just different practices in place. I'm unsure the cause of that, but we did see slight increases, but like I said, not to the volumes that we were seeing previously with our hospitalized patients.
Yeah, thank you. And the surveillance report that we have on our figure 6 here, it actually won't, the extension only goes to MMWR week 12. So in terms of looking at that across the spectrum, we can pull up and share kind of a different, kind of a longer timeline for all of you so you can see visually where that is. But I defer to Kallie in terms of the experience and that impact on the healthcare system. But we'll follow up with another figure that kind of shows the exact timeline for everyone.
Cool, thank you.
Any other questions today? Quiet group. Okay, well, with that, we'll go ahead and end today's press call. And again, I just really appreciate you all staying connected and sharing this information with the community. And we'll be in touch. So have a good rest of your day.